The College of Nurses of Ontario presents the Ethics Practice Standard, Maintaining Commitments. The consideration of ethical issues is an essential component of providing care within the therapeutic nurse-client relationship. Nurses may encounter ethical situations in their everyday practice. Understanding and communicating the client's beliefs and values, as well as their own, helps nurses recognize ethical conflicts and work through them if they do occur. Maintaining commitments means keeping promises, being honest, and meeting obligations. Nurses have an obligation to maintain commitments toward their clients, themselves, nursing colleagues, the nursing profession, other members of the healthcare team, and quality practice settings. Nurses' primary commitments are to their clients. They are obliged to provide empathetic and knowledgeable care and refrain from abandoning, abusing, or neglecting clients. Nurses act according to clients' wishes and standards of practice. The commitment to clients also includes a commitment to respect the client's family members and/or significant others. In some situations, nurses need to address areas of conflict between the wishes of the family and those of the client. For example, a client has decided not to proceed with a treatment plan that his family supports. His family is trying to influence the nurse to impose their point of view on him. The nurse talks with the client and suggests a referral to a social worker, to which the client agrees. The nurse has identified that the client's needs conflict with those of his family and has taken action to provide resources and support to enable the client to have further discussions about his wishes. Nurses demonstrate a regard for maintaining commitments to clients by putting the needs and wishes of clients first, identifying when clients' needs and wishes conflict with those of family members and encouraging further discussion about the client's needs, identifying resources and supports to enable clients to follow their wishes, and identifying when their own values and beliefs conflict with those of the clients. Nurses maintain commitments to themselves by recognizing and functioning within their value system. This may include working in a practice setting that doesn't conflict with their beliefs and values. For example, a nurse whose religious beliefs do not condone birth control may choose not to work in a clinic counseling teens on birth control methods. Nurses' values sometimes differ from those of other healthcare professionals, employers, and/or clients. When a client's wish conflicts with a nurse's personal values and the nurse believes that she or he cannot provide care, the nurse needs to arrange for another caregiver and withdraw from the situation. If no other caregiver can be arranged, then the nurse must provide the immediate care required. This action supports the commitment to the client's well-being by ensuring that the immediate client care needs are met. Nurses have a commitment to each other. They show consideration and respect for each other by working collaboratively and promoting an environment of collegiality. Respectful behavior contributes to the best possible outcomes for clients. Nurses have a duty to know and acknowledge each colleague's role and unique contributions to the team. However, in situations where clients' safety and well-being are compromised, nurses' primary responsibilities are to their clients. Nurses, therefore, need to take action when colleagues put clients at risk or are abusive toward clients in any way. Beyond having a commitment to each other, nurses have a commitment to the nursing profession. Being a nurse brings with it the respect and trust of the public. To maintain this respect, nurses have a duty to uphold the standards of the profession and conduct themselves in a manner that reflects well on the profession. Self-regulation is a privilege, and each nurse is accountable for the responsibilities that accompany this privilege. Nurses also need to respect and maintain commitments to all healthcare professionals and their roles. It is expected that nurses collaborate and coordinate care with members of the healthcare team and with colleagues. Team cohesiveness promotes the best possible outcome for clients. For example, a nurse case manager consults with the healthcare team to determine the needs of the client and available resources, consider the client's wishes, and refer the client to the appropriate team member. Nurses are best able to maintain commitments and provide safe client care when their environment supports quality professional nursing practice. To promote quality workplaces, the college has identified attributes or characteristics that support quality practice. These attributes are accountability, advocacy, commitment, professional support, and environmental culture and climate. In partnership, employers and nurses have a shared responsibility to create and maintain environments that support quality practice. There is an interdependence of individual and collective accountabilities to develop sustainable systems that promote safe and ethical client care. When nurses demonstrate advocacy and autonomy, they identify areas in a practice environment for improvement. Nurses can use organizational supports that are in place in the practice setting to promote change. Nurses are expected to engage in activities that will ultimately benefit client care and support professional nursing practice. Through the support of nursing leadership and in collaboration with all members of the healthcare team, nurses are positioned to provide safe, effective, and ethical nursing care. You have now completed Chapter 2 of the Ethics Learning Module. There are additional chapters in this module. Please close this presentation and return to the Learning Center to choose another chapter.